Good afternoon. I'm Dr. Jazz Atwal. I'm the Deputy Chief Provincial Public Health Officer of the province of Manitoba. Today we are announcing one additional death due to COVID-19 from the Winnipeg Health Region. I want to extend my condolences to the families, friends, and caregivers of the individual announced today. The current 5-day COVID-19 test positivity rate is 3% provincially and 2.4% in Winnipeg. As of 9:30 a.m. today, 54 new cases of the virus have been identified in Manitoba. Additionally, public health officials are announcing that one confirmed case resulting from the B.1.351 COVID-19 variant of concern, first identified in South Africa, has been detected as well. The case identified today is from the Winnipeg Health Region. We are investigating the case, and if a public health risk does exist or is identified, public health will notify. The total number of variant of concern cases in Manitoba is 9. The total number of lab confirmed cases in Manitoba is 32,104. New public health orders came into effect this morning. Manitobans can now designate 2 visitors to their household or designate a second household so that the 2 households can visit each other, as long as everyone in the house has authorized those designated individuals to visit. Gathering limits at an outdoor, public, or private place will increase to 10 people, including for outdoor non-organized sport or recreation activities. Additional changes impact businesses, retail and restaurants, and recreation and fitness facilities, and are all available online. The orders will expire on March 25th. Later in March, we will evaluate whether we stay at this level or make other moves to reopen. It all depends on how Manitobans did and what our data shows. Looking ahead, we know that many Manitobans are starting to think about their spring break, Easter, and Passover plans. Even with the changes made today, non-essential travel continues to be discouraged. If you travel outside the province, you need to self-isolate upon your return to Manitoba. People will be able to celebrate with one other designated household or 2 designated people for the holidays. While I understand that this is not how we all wish to spend spring break or celebrate the holidays, this is not forever. Every day our case numbers improve and more people are vaccinated. This is bringing hope. With improved case numbers and increased vaccination amongst Manitobans, we need to remain vigilant. There continues to be risk, but we need to learn to live with the virus. Our hospitalization numbers are due to COVID-19 remain elevated, and this affects how we are able to deliver health services. There continues to be a number of people in intensive care units, and these resources are still stretched. And there's the possibility of variants of concern spreading in Manitoba as well. These variants can spread more easily. We could see increasing numbers rather quickly, which would impact our case counts and our hospitalizations. We all know what we need to do. Focus on the fundamentals, stay home when you are sick, and avoid activities that are known to cause the greatest risk, such as crowded places, closed spaces, and close contact settings. This will help contain the spread of COVID-19 until we can immunize and better protect more Manitobans. Your actions have made a difference and will continue to make a difference. We all just have to do this for a little longer. Thank you, and now I could take questions.
To our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CHVN, Taylor.
Hi, good afternoon. For places of worship, they're currently limited to regular services, but the use of regular is quite vague. You know, a lot of people are wondering if they can do things like Sunday school. Can you just explain what the province means by a regular service?
So regular services in settings of, religious services, I think are fairly self-explanatory. Things like church school services, let's say, or church groups meeting would have to follow the gathering sizes. So they would be indoor gathering sizes related to that. But for religious activities such as services, are listed within the orders. And I think those are clear. But anything else happening in that facility would likely have to follow under a gathering rule for indoors.
And can you explain why we've got that gathering indoor rules when places like recreational facilities could have 25%, but a worship facility would have to follow those indoor gathering sizes for things like religious causes?
Yeah, so we have to look at taking our steps slowly to be able to open up a variety of different sectors within Manitoba. People coming to recreational facilities, they should still try to distance and move away from each other if possible. When they're engaged in that sport or activity, let's say from a rec basis, we do anticipate some interactions between individuals, but usually that is limited as well. When you look at other places, let's say gyms or fitness centers, again, that distancing is there, and it's mandated within the rules or in the orders as well. When we're looking at other types of gatherings, we want to limit, and we need to continue to limit the number of interactions between individuals. When we look at one sector specifically, it's easy to say, or it might be easy to say, this is a low-risk activity, there's only a handful of people here. But you have to put a multiple on that. You have to look at everything that is being open right now. And there's a lot of things that are being open which will have an impact on the number of interactions one person could have, right, versus a whole family could have. And that does increase risk. So, we are taking that balanced approach here. There's an opportunity for basically the majority of businesses to open and sectors to open. Religious activities can happen as well, and we think all these things are important for people, but we can't just have everything open at once. We will run into trouble that way, so we're going to take this graduated approach. And again, something like capacity limits related to what is open right now will be looked at on an ongoing basis. And I mean, these orders are in effect for 3 weeks. And we'll see where our numbers are at, where the risk lies at that point, to see what else we can do from an orders perspective at that point.
Thank you.
From the Winnipeg Free Press, Carol.
Hi, Dr. Atwal. We've been told that the province will only reveal details about variant cases if there's a risk to the public. So based on that, does that mean you don't believe the 9 variant cases to date are a concern for the general public and that they're not considered community transmission?
Yeah, so, at the present time, we have 9 confirmed positive variants of concern. So we have, 3 South African variants, which is a B1351, and 6 of the UK variants, which is a B117. Investigations either have been completed or some of them are ongoing. Obviously, there was a new one identified, so that investigation isn't complete. If there is a public risk in relation to any of these variants of concern, that information will be provided to the public. At this point, we haven't been able to find any concerns in relation to the public related to this. So I know a number of these are related to travel, and I believe those cases have been closed already, or those investigations essentially, and there's still, a couple investigations still pending. So if anything does come out of those investigations that the public needs to know about, we will provide that information to the public.
And so now that 4 vaccines have been approved in Canada and all Manitobans are expected to get first doses in May, when will the vaccine Q calculator be updated, and how often is it updated? Just because, it's telling people today that they're in the same spot in line that they were in when the Q calculator was first introduced on February 2nd. So, if the province is delaying second doses of the vaccine, you'd think people would be moving closer to the front of the line. So can you tell us what the plan is for the vaccine Q calculator now? Will it be updated regularly? What can people expect to see any change in their spot in the queue?
Yeah, that's a great question. I don't have the details of how often that is going to be updated. I think that might be a question that's best left for the vaccine task force, and we could probably provide some information once we seek it out from them as well in relation to that. I just don't have the background information on how often it's going to get updated or when it is going to get updated. It likely will depend on certainty in relation to vaccine doses as well.
From Global News, Anya.
Good afternoon. I know this has been asked before, but I'm going to ask it again. Why have this color-coded system if we don't seem to use it when things improve, especially in some regions where they're seeing single-digit daily cases fairly frequently?
Yeah, that's a great question. I think others have posed that question to public health as well. When we're looking at a color system, when we're still in red, there's orange, there's green. there's yellow. We still have risk here, right? So there still is some risk. Some of our indicators are still in the red. Our hospitalization numbers are still high. Our ICU numbers are still elevated as well. So we're at a transition point here. Our case numbers are coming down. We still have some indicators that are pointing red in relation to maybe some areas with test positivity. Again, the ICU use, the hospital use as well. So we still need to be, from a communications perspective, from a desire to, limit risk, we still need to be aware. We need to be a little bit more aware right now because it's a very important point that we're in within COVID-19 in Manitoba. We continue to want to open up, but we still have to ensure that we're doing those things that we can to help mitigate the risk of propagating COVID-19. We are starting to see some isolated cases of variants of concern in Manitoba as well. We haven't seen any community transmission related to that, but that is a risk as well. So we still want to remain vigilant. And again, the color coding will be looked at on a regular basis as well. And if it needs updating, we will update that as well.
Okay, and yesterday we heard that restaurants can now ask people to simply declare on paper that they live together. When I spoke with someone yesterday, they said this was to make it easier on restaurants and families who may have multiple living situations with children. But how does this not just make it way easier for people who aren't living together to sign, say they do, and will there be consequences if those people are caught lying?
Right, so we know that public health orders have impacted restaurants and impacted the Manitoba industry. We know that there's been concerns, there's been some issues related to how certain patrons have behaved at restaurants as well. So there are options for restaurants. They can ask for ID. They can also look at a declaration form being written by the individual or the patrons coming in saying that they are from the same household as well. Again, I think as Manitobans, we need to understand that restaurants pose a risk. The reason why public health is asking for individuals to only sit with their own household is we want to make sure, if there is COVID floating around or COVID-19 floating around, we're not increasing risk amongst households. So we do need to be diligent about that. If we start to see a number of cases being generated because people aren't adhering, public health will have to do something about it. So we are asking Manitobans to be honest. We are asking restaurateurs to do what they can to partake within the desires of the orders, within the spirit of the order as well. So there's options there now from a restaurateur perspective to be able to do that. There are other individuals who may not have ID related to with an address written on it as well. So this provides those individuals or those families to come to a restaurant to partake in a restaurant, a night out, and still be able to access it without having an ID with an address on it. It might just have their name on it and their picture. So we want to be cognizant of that, but we still need to be Manitobans. Let's be honest. When we're going out, let's do what we can to continue to prevent COVID-19 from spreading in Manitoba.
Thank you.
From the Brandon Sun, Michelle.
Good afternoon, Dr. Atwal. Today I'm asking questions on behalf of funeral service professionals who have not been getting answers from public health and the government generally during these past few months. So my first question is, there seems to be no consistent internal logic to applications of many of the rules in regards to funeral homes and churches specifically. I can go to a church service on Sunday and attend with 100 people. But on Monday, if a member of the exact same church has to have a funeral service for his wife at that church 24 hours later, then it's only safe to have 10 people in the exact same space. What is the rationale for this inconsistency?
Yeah, so public health has been engaged with funeral homes. We have sent out interpretations of the orders and expectations. I've been involved with that directly for sure. Others have as well. There are risks associated with funerals, with weddings, close, prolonged indoor contact. There's a lot of emotions in play when we're dealing with funerals and weddings as well, so that does increase risk. We have seen, outbreaks related to funerals, outbreaks related to weddings all through Manitoba. This isn't unique to Manitoba. We've seen it nationally, internationally as well. So we do have to be cognizant of that, right? We have to limit that risk. When you're looking at large churches, let's say, that are able to have 100 people, they are required to keep those individuals or households distanced as well, and there are capacity limits there as well. That does pose risk as well. We understand that, but that's why we also have that capacity limit. So, we do, again, need to be cognizant that, this impacts all Manitobans. There are limits on occupancy. There are some who have limits in sheer numbers, in absolute numbers of individuals allowed to partake. And we understand that is a struggle. It's a struggle in times of emotion, but we still have to worry about COVID-19. We have to worry about that risk. And again, we want to mitigate the spread of that risk. So again, those orders will be looked at on an ongoing basis. I can't speculate what the future will hold, but for the next 3 weeks, this is where it stands, and we'll take a look at Manitoba's situation at that time to see what else we can do to open things up for Manitobans.
Thank you. The second question also comes from the president of the Manitoba Funeral Service Association. His question is, why has this government never once reached out to the Manitoba Funeral Service Association for feedback on planning to conduct funeral and memorial gatherings safely? From whom are they getting advice on proper funeral protocols? It does not seem that they're getting any advice from within our profession. Why have they not responded to any of our offers to be of assistance?
I can't speak to government specifically in relation to that. I know from the public health side, we have been involved. We have looked at protocols in the past, so we'll continue to look at protocols, et cetera. Again, I think this comes down to a certain sector about capacity. And I understand it is difficult. I think, all along it has been difficult. Families have postponed funerals. Families have postponed weddings. These are important things in people's lives, but so is COVID-19. So is COVID-19's impact on Manitobans, on the acute care system. And again, we will work with sectors. We have no problem working with sectors. Because a protocol is there, doesn't necessarily mean there's no risk associated with that either. Right, so we have to look at everything put together, and we will continue to work with different sectors. So that work is ongoing.
From CJOB, Will.
Good afternoon, Doctor. I'm wondering, some people might see the low case numbers or low test positivity rates and be thinking that our reopening plans are happening too slowly, that it's still overly cautious. Can you just speak to what are you waiting for, so to speak, before gathering limits or restrictions around restaurants, for example, could be loosened even further?
Yeah, so when we're looking at case numbers, our case numbers are down, right? So, in Winnipeg, let's say we had 14 cases in Winnipeg. We had 53 new cases in Manitoba today. 33 of those were in the north. 21, let's say, were First Nations. We have a number of people still in hospital. So there are 55 people with active COVID-19 in hospital right now. There's still 116 people who are recovered from COVID-19 but still need to be in hospital. We have 24 ICU beds occupied with COVID-19. That still has an impact on our acute care system. We are still shifting workers away from their regular positions to work in the ICU at this point. That impacts people's ability to access surgeries or diagnostics, et cetera. So when we're looking at being able to open up, again, I think we made a substantial move here today in relation to what's being allowed to open up. And it's right across the board that, either capacity has gone up or something that wasn't allowed to be open before is allowed to open now, and it's sort of increased the potential number of individuals able to come into one's home as well. So all these things pose risk. When you look at life previously, you woke up, let's say, your family of four, the kids went to school, and as one parent, maybe you went out and you came back and you went to the grocery store. That's it. Right now, that opportunity is there for each one of those individuals to do those same things and go out to a retail business, to go out to get a haircut, to go out to do ice skating or ice hockey program, to go out and go to a restaurant. So every single one of those things is an interaction or a potential interaction, and there is risk there. So when you put that multiple on there at a family level, it really increases the number of interactions, which increases risk. And you put that at a population level. There's 1.4 million Manitobans. Think about all those extra interactions that are going to happen and the potential risk associated with it when COVID-19 still exists amongst the population. So we have to take that into account. So we will, open everything up right now. I think we've really push the envelope here right now to see where this takes us. We'll see how our case numbers generate over the next 2 to 3 weeks' time, what our impact on our acute care system is at that point. And that'll let us know if we could open up further or stay where we're at. Coupled with this also is we're also vaccinating, so vaccinations will have a tremendous impact on case generation. So right now we have a limited supply of vaccine. Over the next 3 to 4 weeks, we're going to have another, a few like tens of thousands of more Manitobans actually vaccinated by the end of March, which, sounds great, but there's still hundreds of thousands of Manitobans that still need to be vaccinated. But, we're targeting vaccine to those at greatest risk of entering into the acute care system, or from passing away from COVID-19. Again, that'll have an impact on what we're able to open. So there's a lot of work happening here. We do have to be judicious. We have to, take this slow. Otherwise, we might have to put on the brakes. And that's something we don't want to do. We want to have a nice gradual reopening where we don't, start and go. That has, I think, much more of a negative impact on people, on society, than if we're able to just continue to gradually open up.
Okay, thank you. And I'm wondering, with the expedited vaccination timeline here in Manitoba, could we maybe see a return of fans in stands for sports or maybe other kinds of public functions, later this summer into the fall after X amount of people have received that first dose?
Yeah, that's a great question. It's really hard to speculate about the future, but that is something public health is thinking about. We are actually doing some research on it, and we're engaging our provincial partners and federally as well in relation to potentially what could or could not happen with vaccines. And I think from Manitobans' perspective, the most important thing here is when your time comes to get a vaccine, register, go get that vaccine. The quicker Manitobans get vaccine, the more Manitobans get vaccine, the greater the opportunity there is for public health to consider having those things occur. So I think that's the most important thing, but work is being done on that. I really can't speculate 3 months down the road at this point.
From the Winnipeg Sun, Glenn.
Yes, Glenn Dawkins from the Winnipeg Sun. Dr. Atwal, where you say that over the next 3 weeks you'll look at how this is going to consider further easing of restrictions. Can you say what kind of benchmarks you're going to be looking at, or what sort of things? Will it simply be the positivity rate or the number of new cases, or what exactly is going to be the thing that brings us to the next level of easing of restrictions?
Yeah, I think I've alluded to this already. I think we look at a number of indicators, right? So we look at the number of cases being generated. You could talk about test positivity as well. You could talk about acute care bed use from a hospital bed perspective, from an ICU bed perspective. We could look at mortality as well. We could also look at what happens with a variant of concern if it does come into play with unknown or community-acquired transmission happening in Manitoba. So there's a number of variables here. What we're also going to be looking at specifically is acquisition events for everyone. And if we see that we've opened something up and there's a lot of acquisition events associated with something, we might, again, have to do something about that and maybe change how the orders look. So there's a lot of variables at play. There isn't one single indicator that we look at. It's everything put together. We look at all the indicators. We look at what's happening in Manitoba. We take a step back and we really try to understand where risk is, if there is risk, and decide what that next step would be. So it's not just a single number that we look at in any one indicator. It's everything put together.
Today, I believe Health Canada approved the Johnson & Johnson vaccine, gives a fourth vaccine. Do you have have an opinion on having another weapon in this fight against COVID?
Yeah, the weapons are great. I remember sitting up here, and when the vaccine first became available, the Pfizer product or the Moderna product back at the end of December, it felt very surreal. We're at a really good point here where we have 4 vaccines now approved in Canada. We've been delivering 2 different types of vaccines already in Manitoba. We have a third one that we're going to be delivering right away. We have a 4th one in the pipeline as well, and probably in a number of weeks we might have a 5th or 6th one as well. It just gives us another tool to reach out to everyone in Manitoba to be able to get vaccinated, and it really it really, is interesting. We're greater than a year into a pandemic. We have a vaccine. We have multiple vaccines developed. The vaccines are very effective. They're very safe. And we have a tremendous opportunity here that, with great uptake amongst individuals to really limit that risk with COVID-19. To really kind of halt a pandemic or a risk in Manitoba, let's say, if we're able to. So it's a great feeling, but I do encourage Manitobans, when your name is called, essentially, sign up and get that vaccine.
From CBC Radio Canada, Matthew.
Hi, Dr. Atwal. Do you think you will be able to complete your vaccination plan at 20,000 doses per day by April?
Yeah, so, there's been a tremendous amount of work on the vaccine side. I've been involved as well through this. We have great people in play. We have a great number of workers in play as well. The planning's gone really well. We're operationalizing as we want to. And that goal of 20,000 is there. And I think we'll make that goal no problem. I feel very confident in the team that's involved with that. Again, they've got some great people doing great work. This is Manitoba's most significant immunization campaign in its history. I think we have the right people in place. I think we have the right resources in place for this as well. So from a planning perspective, from an operations perspective, I think it's there. I think they'll be able to accomplish that goal. We have a number of other individuals involved in public health related to looking at new types of vaccines as well, looking at vaccine safety, et cetera. And everyone's ready to go. And we have been going right now. And as this ramps up, we're going to continue to keep pace. And that 20,000 goal is going to be a fantastic number to get to. And again, it provides Manitobans a real great opportunity to get that vaccine in a fast fashion.
Thank you. I don't have follow-up question.
From CBC Manitoba, Bart.
Hi, Doctor. Given that we know that indoor transmission is a lot worse than the threat posed by outdoor transmission, why is the household-only rule for dining in place for patio dining right now?
Yeah, so, we were designing the orders. We were in the throes of winter here. I think we have an unexpected outdoor summer temperature swing up. There still is risk there. The patio is considered part of the restaurant. So they do have to follow those orders in relation to the patio as they would indoors, obviously. And that's something that we're going to look at, obviously, going forward as well. So we'll take a look at the orders. We'll take a look at where Manitoba is at from a weather perspective. And if, we do need to make changes with that, we will look at doing that.
Great, thanks on that. And I realize you're not part of the vaccine team, but after the vaccine team had its briefings today, the province put out this information about going back and investigating whether healthcare workers' eligibility claims were false and potentially passing over the results of investigations to professional bodies or law enforcement services. So to the best of your knowledge, how many incidents were red flagged to warrant such a special order?
Yeah, I don't have the details of that. I know that that ability does exist to ensure that there is a check system in place there to determine if, did someone who wasn't supposed to get the vaccine. So there's work being done on that. I just don't have the particular details of that. And that's something that might be best asked to the vaccine task force, and they might have some answers related to that.
From the Canadian Press, Steve.
Hi, Dr. Atwal. Looking at the numbers again on a per capita basis, the northern region is far and away getting hammered here more than other regions. Can you tell us what's happening in the north? We've heard of some outbreaks in First Nations communities in Thompson, but can you give us an update as to the battle up north?
Yeah, so there's a number of variables here that are involved. We do have some disadvantaged folks. We have some housing issues within a number of communities. It's throughout Manitoba, but I think in the north it is a greater issue there. We have two larger First Nations communities that are, have had an outbreak, continue to have an outbreak, but their numbers are declining as we go forward. So if you look at, the Island Lake area and Cross Lake, those numbers seem to be improving, although there's still risk there, and public health is working diligently with the communities and First Nations Inuit Health Branch and many other partners to help control that outbreak in those communities. A newer First Nations communities is in the throes of an early outbreak as well. So Matthias Colomb or Puckatawagan is that community. It's not as large as the other communities, but still has a couple thousand people there for sure. And work is being done with that community in relation to mitigating the issues of COVID-19 within that community. So again, we have public health nursing involved. We have First Nations Inuit Health Branch. We have First Nations leaders in the community as well. We have tribal councils aiding. There's a whole team here to help really reduce that risk and get that under control. When we're looking at smaller defined settings, we've seen this in other locations, it's quite easy for that virus to spread. So it's not unexpected that once, we see a case or two cases within a smaller community that isn't able to, physically distance as well, or lodging's an issue, et cetera. We do see that risk spread, and we do generate a lot of cases. It's sort of on a sustained basis, but over time, all of these communities, the cases have settled down. So we should see these cases settle down. It won't happen in a day or a week. It will take a few weeks. And that's our experience so far with a number of communities like experiences similar types of outbreaks as well. So, the numbers are being driven again by household exposures, and newer communities involved, and work is being done to limit the risk in those communities as well.
Thanks. And you mentioned earlier, the strain on hospitals continues even though new case numbers come down. It takes a long time for that to work through the hospital system. There's still several people in intensive care with active COVID cases and others who are no longer active. Can you give us an update as to the number of surgeries being postponed or canceled and how the health system is being affected right now?
Yeah, I don't have the details of that. I know some numbers were provided a while back, and I mean, the numbers were in the thousands. I just don't have an updated number, but that's something we could look at finding out and getting back to you on.
From CTV Winnipeg, John.
Good afternoon, Doctor. Licensed premises are allowed to open, and we understand that they're required, though, to serve a meal if they want to serve alcohol. Could you please explain to us the reasoning behind this and tell us what qualifies as a meal? Like, for example, could they sell one single item at the bar, or does it need to be a sit-down meal?
Yeah, so there's a lot of different types of liquor licenses out there. We wanted the opportunity for every business to, to try to open up. Some licensed places have restaurants, some don't. We wanted risk to remain low. We wanted licensed premises to behave like restaurants as well. If there's an expectation on restaurants, that same expectation should be on other establishments that are very similar as well. So, this almost the same rules apply, I would say. The owner has to ensure that people are from the same household or try to ensure that, or a declaration needs to be signed. If alcohol is ordered, food should be ordered as well, or has to be ordered as well. What constitutes a meal? And I think for different people, different things are a meal. Could you argue a chocolate bar is a meal? I'd probably say no. I think there has to be a reasonableness here. So it's not explicitly written in the orders, but I think it just has to be reasonable that someone is ordering a meal, has a meal, and eats a meal.
Okay, thank you for that. When it comes to variants of concern, can you please explain to us, though, why public health is not able to tell us if individuals who tested positive had traveled or not? Is it not important to be transparent with Manitobans by releasing at least this basic information when these variants of concern are detected? Like, I know you've said in the past that it's a burden, but I guess I'm just unclear how it's a burden to let the public know if the case is related to travel or not.
Yeah, so there's some details here. It's a case investigation. It's a contact investigation. I think from a public's perspective, they need to be aware of whether there is public risk associated. If these cases, obviously they were imported into Manitoba. We didn't produce a variant here that is sort of a B117 variant or a B1351 variant. So they are imported. They are travel related, to the best of my knowledge. There are still a couple investigations underway as well. So we aren't going through the details of every single case. We haven't done that really. I know early on, we talked about screen positives, and that that can cause issues as well. The way it's messaged, the way it's taken up by the public. We want to be firm with everyone. We want to state the facts. The fact is, these are the number of variants we have that are confirmed. There's no public health risk associated with these variants at this point that we're able to detect, and that's all that's required. Cases are isolating as they should. The contacts are isolating as they should, and they're doing what public health is asking them. So again, I think intuitively, these are all cases that were imported in. I don't think that's something that we're hiding. I think that's very reasonable to say and assume. And again, if there is that risk to the public, we will provide that information to the public as well.
Thank you.
Our final reporter this afternoon from City News, Jonas.
Good afternoon, Dr. Atwal. Hasn't been, I would say, a lot of good days in the last year or so, but this certainly seems to be one of them with the news this morning on vaccine timelines and where our caseload is. Maybe just a thought on today.
Yeah, it's a beautiful day outside, right? The weather's great. It was nice to walk outside today. Had your jacket undone. We got news of another vaccine being approved. Our case numbers are dwindling down. We do have some issues in smaller areas and smaller pockets, but it feels great. Again, I wouldn't call it a surreal moment. I think, but it's a promising moment. I think we're headed into a really good time here. And a chance for Manitobans to again get back to those things that they love. But I think Manitobans need to continue to adhere. We need to continue to do those non-pharmaceutical measures. We need to distance. We need to limit our interactions with others ongoing. And continue and persist with this. I think with the weather changing as well, it provides Manitobans a greater opportunity to head outdoors, to do other things outdoors as well, which is great for one's mental health. I feel better when the sun's out. I like summer. I do a lot of outdoor activities. I feel fantastic in the summertime. I think a lot of Manitobans follow suit as well. So it feels great. I think, again, we're in a really good spot here. I think we're, I kind of mentioned the word unique. Manitoba is unique compared to a lot of other provinces and how we approached COVID-19, how we handle it as a province, as a population. I think it's put us in a really good spot right now to get things open, to get that graduated opening happening and get Manitobans back to the things that they love to do.
And just as a follow-up here this afternoon, for folks that may have been disappointed in the initial vaccine rollout, or, concerned about Canada falling behind, I guess maybe just a message to them about what they should expect moving forward.
Yeah, it's, when we look at vaccines, we have over 7 billion people in the world. Everyone wants this vaccine. We have 150, probably more, greater companies developing vaccine. So when vaccines first rolled out, it's not like there's billions of doses available. Companies have to do a whole bunch of work to get those vaccines developed and produce those vaccines. And I know it's a struggle sometimes to understand that, we're a population of 1.4 million in Manitoba, just under 40 million in Canada, but there's 7 billion people in the world. So there is a demand for these things. There was probably some disappointment early on, I think. I think we need to have good expectations here. We need to realize that we're far better than lots of other countries. We're far better to be able to get over COVID-19 than a lot of other countries as well. So again, I think we're in a good spot. I think patience is a key here. There's a lot of work being done, tremendous amount of work being done 7 days a week. By government, by public health, by other practitioners, by health in general, by people making sacrifices every day, and they have been for over a year, to continue that work Don't get disappointed. Again, when your name gets called for that vaccine, go get that vaccine. And the horizon isn't too far down the road here. We're going to be in a really good spot, I think. We have a great opportunity here. I think we're in a unique position, and just remain resilient a little longer. And I think Manitobans won't be disappointed.
Thanks, everyone. This concludes our media briefing.